we do that today?
Okay, thank you. Welcome, everyone. You still have 2 minutes to get your +1 in here. Remind them. Sometimes your +1 needs a reminder. Hey, the party is today. We are spilling the tea this evening, so please get them on. We are streaming on Facebook on Dr. Tiffany Marie. So if you go there, you can highlight that. You can share that with your contacts. Maybe somebody you think needs to hear this. You can tag them on there. Let's expand the reach of how far this tea spills.
Well, apparently it spills pretty far. It reaches pretty far. So apparently it does. Okay. Now, I am Dr. Tiffany Marie. I am a double board certified physician and family and lifestyle medicine. And I was just crazy enough to drink this tea. And so here we are. We're talking about the spilling the tea, breaking the misinformation that has led to so many people still feeling sick. And we're going to go into more detail about that. But I have my lovely co-host and friend, Dr. Esther. Dr. Esther, just say hello to the people.
Hello, people. Well, my name is Dr. Esther. I'm a board certified family medicine physician based out of Houston, Texas, and I get to do this lovely spilling of the tea with Dr. Tiffany. I met Dr. Tiffany about 18 months ago, and I listened to her, and I joined because I was like, there's no way this board certified family medicine physician is talking about something crazy. And because I thought you'd be crazy to risk everything you worked for to talk about this. And that's part of the puzzle of why I am here. And well, if she was crazy, so am I. So because we are here now doing this, but we know we're not because we're getting results with people, not just with ourselves every day. And that's why we're here. So thank you for joining us.
Yes, thank you, thank you, thank you. That was so funny. Say hello to the people. Hello, people. I don't think I'll ever get that out of my head. That was funny. Okay, so I am silly. And so I'm about being myself on these calls, right, Dr. Esther? Yeah.
Yes, yes, it's
What
all
is
about being ourselves.
What's really great is that being myself, I've got to run into just a lovely soul, a lovely hearted person who gets the mission, gets why we do what we do, cares about people. And you know what? She's not a doctor, people. How about that? Okay. In fact, I don't even think you're in healthcare, Sheridan, but I'm gonna let her come on and tell her story. And it's great to connect with people who aren't necessarily doing what I'm doing, but they get it. They understand. And so here we are, Miss Sheridan. I call her actually my work bestie. This is somebody who just shares my heart. We get together, we joke, we laugh, we cry, but we understand what we're doing. So thank you so much, Sheridan, for agreeing to come on and share your story with how you started drinking the Kool-Aid and your life turned around entirely. So thank you so much.
Yeah, you're welcome. I'm excited because it really has been life-changing. Yeah, I'm not a healthcare professional. I'm not a doctor. I just have my story. And so it goes back to when I was a teenager and I had PCOS symptoms, cysts on my ovaries that would burst, send me to the hospital. And the doctor put me on birth control and then on antidepressants. I was really struggling, and that in itself is a guessing game. I'm sure you guys can attest to that as a doctor. It's like, okay, let's just try and figure out which antidepressant will work, which SSRI. Um, and so that, always struggling with my fatigue and energy um, and then gut issues started creeping in. And over the years, it just kind of continually got worse, and to a point that I thought I had something seriously wrong. Like my bowel movements were off. This was just not something right. And getting on more antidepressants to try and manage the depression and anxiety. So I went to a gastroenterologist and they did all of the tests to see if there was anything wrong. And he came back and said, that he couldn't really see anything and that it was probably anxiety. And I was like, you've got to be kidding me. I'm like, I'm on 4 antidepressants right now, just trying to manage depression and anxiety. I have done therapy. I've done counseling. I've done all of the things. I'm trying to work out. Like I had no, it came to a point of like, well, this is just something that I'm going to struggle with the rest of my life. And so I was just like, well, I've just got to get used to it. Um, and then, a little bit later, my husband had kind of been trying to tell me to try the system. And I was like, no, no, not interested. I was like, I need a surgery. I need a medication, something, anything natural is not going to fix me. And he's like, just try it. I was like, okay, fine. And I literally went into it to prove him wrong. And I'm so grateful that I did, because I don't know if I would have been as consistent with it. And because I didn't want to give him any leeway to say, well, you didn't use it right. And I was like, well, I'm going to do it exactly how it says, to the T, like nothing, there's going to be nothing that he can say. Well, a couple weeks later, after being consistent with it for about 2 to 3 weeks, my teenage son comes home from high school, and it's just me and him. And he says, hey, Mom, how's your stomach? And I was like, it's good. Why are you asking? It's a really odd question for a 15-year-old boy. And he's like, well, I've just noticed you've stopped complaining about your stomach as much. And I was like, I'm like, okay, that's interesting. I'm like, I guess that has been getting better, And then a couple weeks after that, I was talking with my mom about a situation that was going on, and she pointed out that I was handling it really well. And I kind of brushed it off. And I was like, oh, thanks, and she's like, no, Sheradon, like, this is amazing. Like, you're handling this very well. Like, this isn't your normal self. So to have two people close to me see changes in me, that, I mean, it's just been crazy. And I have struggled and been on antidepressants for 25 years. I got at that point, or before I started, I was taking 2 to 3 naps a day. Basically my stomach hurt almost all of the time. And I just thought that was going to be it. And now, after being on it, I am now off all of my antidepressants. I no longer feel like I need to nap. Rarely there's occasions where I'm like, okay, I feel like I need a nap. But other than that, like, my gut issues improved, to where I can go to the bathroom normally. And you guys, if you've had a hard time going to the bathroom and you can go normally, you pray and you thank God that you can go to the bathroom normally, because it is, difficult to have that problem that nobody really talks about. But I'm on here talking about it. But yeah, it's just, again, completely changed my life, my family's life. I can show up better for them. I feel healthier, stronger than I have my entire life.
Awesome, awesome. Well, thank you so much, Sheridan. You know what, one of the reasons why I did like you being on here is because so many times people are like, well, I don't need to lose weight. That's all I see is people with, before and afters, because you can't see depressed versus not depressed in the picture. No, we're trained to be able to put a good face. You can't see anxious versus not anxious, so you can't see how that impacts your quality of life, but it hugely impacts your quality of life. I mean, getting off of 4 medications is not a small feat. That's awesome. Not complaining, and your son noticing that, because they do. Our kids watch us all the time. So they're the best markers for when something happens, for them to actually pick that out and say, oh, your son to pick that out. 15, no less, 15-year-old son. And I know my 15-year-old son, when he opens his mouth, I better listen, because that means he really saw something. So that's huge. So thank you so much for sharing, because you're a great example of how insulin resistance it's not just for a certain size people. It's not just for anybody who looks a certain way. It is attacking everybody. And that's why we're on here spilling the tea. But thank you so much, Sheridan. Your story is awesome. I appreciate you. My work bestie. Show Sheridan some love. That's my work bestie, people. She took the time and jumped on this call. I appreciate you, dear.
Yeah, thank you.
So we had Sheridan's lovely story. And for those that actually do pay attention to when I actually do these calls or do some before and afters, she's always on my before and afters. That is the Sheradon I talk about. And so before I get into before and afters, let's talk about what is the science? What are we dealing with here? We talk about insulin resistance. We talk about, being metabolically healthy. So what are we talking about? We're talking about what happens way before your sugar goes up. Way before your sugar goes up. So you can have metabolic and endocrine health problems way before you go see the doctor and they say your labs are wrong. So we want to talk what happens 10 to 20 years before those sugars go up. And for a lot of us, our body's been trying to tell us something, but we just aren't listening and don't understand what it's trying to tell us. And so for years, many of us have kind of some symptoms that happen. But the first thing I like to ask is what comes to mind when you think of insulin resistance? So in the chat, I'd love for you to put your first thought. Are you just thinking sugar? Are you just thinking weight gain? Are you thinking diabetes? Are you thinking insulin shots? What are the things that come to mind when you think about insulin resistance? I know for me, even as a physician, someone who went to medical school, right, for 4 years, then I had training for 3 more years, and then I turned around and got board certified in another specialty. I didn't have a clue that insulin resistance included so much more than diabetes, that included so much more than prediabetes, okay, or PCOS. I knew about PCOS. But see, this hidden timeline, because the symptoms can happen way years before. This hidden timeline, because the symptoms can happen years before you start to actually develop the sugar issues. So many people start off feeling, healthy. They're in a normal metabolism, and then silent insulin resistance starts to brew. Okay, not quite too many outward signs, but then the symptoms do begin. The energy, the crashes, the cravings, the skin tags, the gut instability problems, the leaky gut symptoms. Blood pressure can kick up for some, cholesterol changes. The triglycerides going up, the HDL going down. Those are good markers of metabolic health, where your metabolic health is. And then pre-diabetes, because now we've gotten to the point to where now there's sugar in the bloodstream along with the insulin, and diabetes. And so these symptoms here, this is some of the whispering that happens. The afternoon fatigue, the brain fog, the belly fat, that stubborn belly fat. You're doing everything else. In fact, you're getting everything else in shape. The scale may be even moving for some people, but it's that belly fat that's stuck there. Mood changes, feeling like you have to have coffee to get through the day, or the sugar cravings. Okay, feeling like sugar is what, makes your day go, and you've got to have your sweet snack in between your meals or right after your meal, or sometimes before your meal, right? Or poor sleep. And then, of course, the difficulty losing weight too. And so if you find yourself on that list with having some of those symptoms, what symptoms would you love to get rid of? Would it be fatigue? Would it be weight? Would it be brain fog? Would it be cravings? Go on and type that in the chat if you are dealing with some of those things. Blood pressure, sleep. What thing would you want to get rid of? What symptom would just be so awesome if you didn't have to deal with it? Because it's important for us to understand that as we move forward. And so instead of the wheel of misfortune, I like to call this the whisper wheel, because it's 18 ways your body signals insulin resistance long before diagnosis. I believe your body's whispering way before it starts screaming. So you have your energy and brain things, the afternoon energy crashes, the fatigue, the brain fog, and then the poor sleep. And then when you don't have enough sleep, do you know that actually makes you want to eat more and choose the wrong foods? Okay, and then inflammatory, joint pain, inflammation. Inflammation is insulin resistance, ugly twin sister. That's how I like to refer to her, okay? It comes right along with it. You get insulin down, inflammation comes down. Insulin, when it's high, it makes you store what you're eating into those fat cells, and you know what it does? It releases an inflammatory markers is what it does. So yes, it increases inflammation. And then the mental health, the anxiety and depression, considering that our gut has so much serotonin in it, we need our gut health to be at its best. And when insulin's high, it starts breaking down those walls even of your gut. So you get those leaky gut symptoms. Low testosterone, PCOS, like Sheradon mentioned, that's the leading causes of infertility amongst women. Fatty liver. Okay, because high insulin actually makes your liver start making triglycerides and decrease HDL, which has the protective benefit. The skin tags, the darkened skin, that's not dirt, people. That's actually from insulin resistance. Unfortunately, so many so many patients go to the doctor and they feel dismissed. They don't feel heard. Your labs look normal, just like Sheradon said, but I don't feel normal, or it's anxiety, or it's perimenopause or menopause. Okay. Standard labs miss early metabolic dysfunction. And that has a lot to do with because of the fact we aren't testing the full picture. Now, how insulin resistance develops. You have your healthy cells, they respond normally to insulin. It's great. They have insulin, they'll tell it, okay, we're going to burn sugar, we're going to burn fat, and it's working like it's supposed to. And so most of us in our 20s, we decided, hey, I want to get my health together. We would make some changes, and over a couple of days, couple of weeks, we were feeling better. It just happened easier in our 20s, right? Well, over time, things do start to change. Now, that insulin key, if you're eating a lot of carbohydrates on a regular basis or eating a carb every 2 hours, which is what we kind of taught you to do, we as in the healthcare community, because that's what the food pyramid looked like. Well, that's constantly allowing your cells to have a lot of glucose to have to figure out what to do with. And when that glucose comes in the body, your pancreas releases insulin. That's the hormone I'm referring to. And it allows glucose to go into the cells to be used for energy. Well, without that insulin as a key, it won't unlock the door to let that glucose in. So if you're constantly eating a lot of carbohydrates, you're going to have a lot of insulin to let that glucose in. Well, eventually the cells stop responding to the key because it's so much insulin out there. And now your poor body is even making more insulin, wearing out the pancreas. And then you end up with even more symptoms because that high insulin is what affects the ovaries, what affects the liver, what affects the blood vessels and causes the lining of the blood vessels to get all lumpy and bumpy. Now your heart has to pump harder, increasing blood pressure. So those symptoms start to happen as a result. And then when you're a woman and you're nearing a certain age, the question then becomes, it's not a question. The answer is, it's just menopause. It's just perimenopause. Well, not necessarily. These symptoms actually overlap even more than this picture says. The irregular periods, yeah, you can have that even with insulin resistance. And so that fluctuation in estrogen that starts to happen before we hit menopause, that actually makes insulin resistance more obvious because estrogen helps our cells to be more insulin sensitive. So when we as women are losing some of that estrogen, we start to see some of these symptoms peak out. That's why for a lot of us, after we get to 35 or 40, we start having these insulin resistant symptoms and we're wondering where they came from. Like I had hot flashes. Thank goodness I started using the protocol, changing my lifestyle. Those hot flashes went away, and not just me, lots of other people. But when insulin resistance is normal, that's during pregnancy, that's during puberty. And that is supposed to happen at those times. We need the insulin resistance. We need to be taking in more glucose. We're growing. We have a baby growing inside of us. In puberty, we're actually growing ourselves. But when it persists for years without resolution, that's when we have a problem. And so the A1C, why doesn't it tell the whole story? Because it's waiting until your sugars are high. And so you can have high insulin with a normal glucose. It is not going to actually pick up anything until your sugar is actually high. And that gives you an average of your blood sugars over 90 days. But cardiovascular risk actually starts to increase way before your sugar goes up. It starts at an A1C of 5.0. Well, where we don't start diagnosing prediabetes till we have an A1C of 5.7 to 6.4. Okay. And then above 6.4, that's type 2 diabetes. But 5 to 5.7 is actually when you're starting to develop cardiovascular risk. So trying to figure out what's happening to you when your body's whispering is huge instead of waiting for diabetes. Now, insulin resistance is absolutely reversible. Nutrition, quality of sleep, healthy relationships, resistance training, stress management, avoiding harmful substances. Those are your toxins. Those are your toxins in the ground too. Those are your things you may be drinking, like alcohol or smoking. All those things actually affect our ability to handle insulin. Metabolic health is significantly affected by all these things right here. And these are actually the tenets of lifestyle medicine. And so if changing your lifestyle were easy, okay, because this is what everybody says is, I can just change my lifestyle. I don't need to worry about your protocol or how you do things. I can figure this out. If changing your lifestyle were easy, everyone would be already healthy. Am I right? I mean, let's be honest. Am I right? Everybody would already be healthy. So if that was so easy to do on your own, nobody would need those shots that people are paying hundreds of thousands of dollars for a month, right? The reality is life happens. Stress happens. Stress increases cortisol, which makes your body have to mobilize glucose, get more glucose in your bloodstream. Yeah, if you're staying stressed all the time, that insulin's going to be high, insulin resistance, hormonal changes. Work happens, caregiving happens to where you're actually getting more stressed. Right? Sometimes the right tools help level the playing field. And so lifestyle is still the foundation. Don't get me wrong. I say this all the time. But when you actually use the right tools, it's like bringing a knife to a fist fight. Okay. The load feels lighter with more help. Now, I have some real results that I want to share real quick. And I'm going to have to change screens just for a second. But real people with real results enjoying their life. So my friend Misty lost 65 pounds, but she's off of blood pressure medicine, antidepressants after 30 years. Those are quality of life changes. Yes, the weight comes, that's a great side effect. But look, reverse neuropathy, all chronic joint pain gone. That is huge, okay? Then we have my friend Donna, who recently turned 72 and looks like she's aging backwards. Reversed her prediabetes, but also was able to help with her astigmatism. This is quality of life stuff. And anytime you catch her, she is dancing, living her best life. And Keith, I mean, I like to joke with Keith that he lost the Backstreet Boy, but he lost about 100 pounds. He did. But what's even more remarkable is that at one point in time, he coded. His heart stopped on the table to where they didn't think he was going to come back. So much so they called his daughter to tell her, oh, your dad's not going to make it. Eventually, he did come back and he was able to start using these products and got his quality of life back. He literally had awful ulcers that were so painful. I mean, you almost could see the bone. They were those types of ulcers that I used to have to send my patients to get an amputation. And so he didn't have to get an amputation. He got his healing. He got his feeling back in his feet, which is huge, and healed that up entirely after 3 months on the protocol we're going to tell you about. And then this is our colleague, his father, who was able to get his A1C down from 7.1 to 6.4. Now, 7.1 is way in the type 2 diabetes range. 6.4 is right at the edge of being pre-diabetic. And he improved his blood pressure. And then our friend's twin sister, who was dealing with PCOS like Sheradon. But what you see in this trilogy of pictures is you see her shrinking every time. But what's significant about the shrinkage is around the waist, because that's where visceral fat is. That's the fat that gets around your organs, and that's the fat that actually increases our risk for cardiovascular disease, stroke, the things that take us out of here. And then Vicky, somebody a type 1 diabetic, pretty much when a type 1 diabetic, they don't make insulin. They pretty much need outside insulin. Well, so she's been using the products, and what she saw that she was able to get her insulin down by 80% and no longer needs insulin before meals, because if you're type 1 diabetic, you need an outside insulin to take before you eat. Well, she's actually gotten her insulin resistance down so much so that she is not, as well as improving her LDL. I mean, this is huge, and you don't see this happen that much with type 1 diabetics at all. And my friend Sheradon. So Sheradon, she came in and shared her story, but what's so important with this is that she was just dealing with anxiety, depression, gut health stuff, and she was able to get her quality of life back. Off of 4 medications is not a small feat at all. And then our colleague here, who really did fasting, he was already doing intermittent fasting and running between pictures 1 and 2. So at 2, he was already doing intermittent fasting and running for 6 years. And then after 2 months of using the protocol we're going to tell you about, he was able to transform, age backwards. He was also able to get his cholesterol down by almost 100 points. Our friend here who jumps out of planes for a living, used to anyway, she wanted to prove me wrong with the skin tags. I said, yeah, the skin tags, that's not a real thing. That's not from insulin resistance. And that's why she took pictures. So she could say, okay, maybe there is something to this. My skin tags look smaller. They look like they're falling off. And acne. So someone dealing with acne, and this is a teenager, no less, because there's times when skin means more important to you, right? You really care about this. But if my back was looking like this, I'd want something too. And eczema. After 6 months of on the Feel Great system, he saw his skin cleared up, and eczema also improves. And I love to talk about my couple who actually did this together. Accountability is huge. That's why we said bring a +1, people. Because when you do this with somebody, it makes a difference. And so Jackie and her husband, she was actually down 124 pounds, but no longer pre-diabetic. And her hubby lost 110 pounds, but off of all his medications, his A1C went from 7.7 to 5.0, which is where we wanted to be, 5.0 and below, to decrease your cardiovascular risk. And Crystal, somebody with Hashimoto's, which is an autoimmune condition attacking your thyroid gland, she was on 15 medications, had leaky gut. And so when she started using the protocol and addressing her insulin, she was able to get off of 13 of those 15 meds. And I mean, like I said, there are so many pictures of people doing this. 73 years old, off of all meds after 7 months of using the products. And she was a diabetic for 23 years. So when we talk about the fact that we're not waiting till you're diabetic. We want to reach you way before then. And so that's the great thing about fixing things where they are, fixing the insulin resistance, attacking the symptoms. And that's what we're able to do with these natural products. We're able to bring a knife to a fist fight. Right, Dr. E?
Yes, we are. And let's talk about this knife that Dr. Tiffany has been sharing, she's been mentioning. And so I am going to tell you more about this knife. And okay, so this knife in short is called the Feel Great Protocol. It's not a program, it's not a diet, it's not something you're going to do for 30 days challenge and you're going to forget about it. You're not going to do this for 1 week, be miserable, or 90 days, be totally miserable, and then go back to your life. No, this is life-changing. And that's what we want for all of us. We want sustainable. And as Dr. Tiffany said, that's the reason why many things don't work. Many of us have tried lots of stuff. Believe you me, even us doctors, we have tried a lot of stuff because we go through the same things. We have tried all these things. We've tried different challenges. I mean, people have taken the things that harm them, but they're not sustainable. You lose the weight, you look good, you take those pictures, and then 3 months down the road, when you take the pictures again, you even look worse than you started off the first time. You are feeling sicker, you're more fatigued, your brain is even foggier. You probably have actually, if you're on medication, you're probably even taking a higher dosage. So no, this is not any of that. This is something that is actually going to improve your life. 2 food-based products, which we call nutraceuticals. And, they described nutraceuticals the other day as a food product whose clinical benefit far outweighs its nutritional benefit. So that's what a nutraceutical is. These are food products, but they have such immense clinical benefits that we use them for that. So these 2 food-based products plus the science of time-based eating, they form this sustainable protocol that we call the Feel Great Protocol. So there are 2 products. The first one is a tea, chlorogenic acid tea, made from the yerba mate plant. It is a super concentrated chlorogenic acid tea. It's not what you would get when you just go buy the yerba mate tea bags or wherever from Amazon or from Whole Foods, or even that drink that they sell at the gas station. And it says yerba mate comes in a can. No, this is not it. This is something clean. It is super concentrated chlorogenic acid, and it has all these other ingredients, the natural caffeine, which for those of you who are concerned about caffeine, it's just what's in a regular cup of coffee. It has theobromine, it has the saponins and polyphenols. And because of all these things, if you can see, each of these things has immense benefit that it gives you. But when they all work together, they give you this benefit of supporting feelings of well-being. That's actually where the word feel great comes from, because you literally feel great. I don't know whether many people have been on medications, you've been on other things, and as I said, things that make you miserable. This is one thing that actually makes you feel great right from day one. And therefore, it makes it easier to actually continue with it because you're feeling great. It gives you a lot of energy. It gives you endurance and stamina if you're the kind of person that works out. And if you're not working out, this will actually help you feel like you want to get into that, which we advise, please do. It supports healthy cognitive processes, your brain fog, improves mental clarity. So ladies, brain fog is not an expected part of perimenopause and menopause. So when you reach 40, it's not a given that you're going to get brain fog. So please take care of that. Don't accept the fact that it's because now you're in your 40s and 50s. Well, that happens. No, you can actually change that. I'm a living example. I didn't believe you could take the cotton balls out of my brain, but I actually did. It supports great weight management efforts by controlling blood sugar, so you're not storing fat. Uh, it also helps promote the feeling of fullness. Now, we are talking about the shots, GLP-1 shots, expensive, all these other weight loss medications. What this product does is that it promotes and it boosts the production of the GLP-1 hormone, the natural one in your gut. And therefore, you actually feel full and you turn off the hunger noise, you turn off the cravings, and that helps you do that part, that other third part of the protocol that we talked about, the time-based eating. When we tell you to go for 14 to 16 hours without a meal, you can actually do it because your hunger noise and your craving noise is turned off. It promotes ketone production, which is something that you want. Now, this product has been tested and has been put at par or even better than metformin, which is the first thing that we give everybody whenever they have, anything to do with diabetes, once they start getting into that spectrum. And you all know somebody who's been on metformin and they talk about all the side effects. The list is endless. Here is something that could be a good alternative. Try it. Listen to your doctor, but say, hey, this is something I can try. It is in the PDR. It is a food product, so don't worry about any interactions with medications. The second product, which is the fiber, it is a blend of the 7 different fibers, all put together, each of them individually with great benefit, but together. And then they also add all these multivitamins to it. You see niacin there. They also add a lot of the other B complex vitamins. It has is it vitamin A, vitamin C in it. So all these things put together, and you get the ideal prebiotic, which is food for your gut. Sheradon talked about how, her gut improved, something that even her 15-year-old, I was laughing about that because, teenagers, by the time they notice something, it's got to be big. It has too much an impact because, these kids are walking around and you're thinking, like, are you even here with us? So for a 15-year-old to have noticed that, it tells you that what Sheradon's life was like before actually made an impact for him. And now he noticed mom was different and different good. And he was compelled to actually mention it. So that part of the prebiotic, what it does to your gut health, that is very, very important. What else does this do when you combine all these things? Fiber keeps you fuller longer, and therefore it helps curb your appetite between meals. When we say eat 2 meals, no snacking in between, someone is thinking, wait, I'm going to go past 3 o'clock without grabbing something. Yes, if you took fiber with your meals, then you're going to feel full and you're not going to want anything. You're not going to crave sugar because you're also taking your Unimatic. It aids in reducing the absorption of dietary cholesterol. It also reduces how high and how fast your glucose goes when you eat. Now, every time we eat, our glucose goes up. If we have fiber before, this fiber matrix, that glucose does not go up. And it does not go up as much. And it's been tested by the home of the glycemic index, because that's what that is called, the University of Sydney. And they have found that it lowers that by up to 40%. So it reduces how high that glucose goes up by up to 40%. And guess what? When you reduce that glucose spike, you automatically reduce the insulin spike. And if you remember what Dr. Tiffany talked about, we don't want too much insulin because that's where problems start. So you nip this in the bud. Then it supports, of course, the healthy blood glucose because you're not getting too much glucose absorbed all at once. So you have this steady blood glucose and therefore supports weight management. It also has been tested by Cleveland Clinic, which, is one of the major cardiac health institutes that, whose studies and evidence we depend on. And what they found is that this product, if taken regularly, could reduce the risk of cardiovascular disease on a population basis, not just individually, but on a population basis, and potentially decrease the need and or dose for lipid-lowering prescription drugs. Now, statins, that's the number one, it's the first line for when it comes to cholesterol lowering. And if you can reduce the dependence on that, statins, anybody who's been on a statin will tell you all the side effects that come with that. It's one of the things as doctors we even talk about when you start a patient on, you're telling them about all these things that you could have and what we need to do and what we need to monitor. Can you imagine if you didn't have to go through that? And I talked about the other time, you know, when you something that does not just work for the one disease that we have diagnosed so far, because we now know that what you have you've been told is this is your diagnosis. It's just what they have found. There's a lot more brewing and just waiting to rear its ugly head, and then we'll add another diagnosis. This is something that is broad spectrum. All these things that it does, this protocol, all these things that it does, it will take care of your anxiety, your depression, because of what it's doing to the gut microbiome, the skin, eczema, acne, because of reduction in inflammation, gut issues, just the IBS, constipation, diarrhea. These are all things. And then combine that with the control of blood glucose, control of cholesterol. I mean, why would you want to take a little, you know, every one thing for this, one thing for the other? You can take something that is wholesome. How do we take this? When we sleep, I'm hoping nobody is eating. So we are fasting from when we eat our dinner. When you sleep through the night, you're not eating anything, so you're fasting. What we want to do is take advantage of that length of fasting and just add a little bit more. So extend that overnight fast by skipping breakfast. And because that can be hard, especially when you're starting this, you take Unimate. Remember I said it helps turn off your hunger noise, so you take that. And then you eat a light lunch. You don't want to break your fast after doing such good work of fasting. You don't want to break it with high carbohydrates. You want to break it with a lot of protein, a lot of fiber, and good fat. And then, you know, the afternoon, that 3 o'clock itis, that peckishness that comes, you're taking another Unimate through the afternoon to help you with that. And then before your dinner, you take your fiber. Just about 5 to 10 minutes before dinner, you take that. And that way, now you're going to be fuller. That meal for many people, that's the largest meal of the day. It probably has some carbohydrates in it. So you're going to make sure that your blood sugar does not spike, and so insulin does not spike. That's what helps people sleep better, because you're not having these spikes and drops through the night. Everything is all steady, so you sleep better. The tea, you can drink it at any temperature. That's the Unimate. You can drink it at any temperature, cold, hot, in between, whatever you like, put ice, you know, as long as you can drink it. The balance, it thickens when you mix it with water. So you want to make sure that it's a temperature where you can chug down very quickly. You sip on the tea, you chug down on the balance. That's the fiber. So room temperature, cold water, definitely not hot. You're going to get a quick porridge on your hands, and you don't want that. So you want a temperature that you can quickly chug down. These products, what makes them different from everything else that is probably out there, over 25 clinical studies now. It's HSA and FSA qualified if you're here in the US. Nutraceuticals, as I said, no drugs in this. Over 65 country presence currently. It is patented, and the best part is that it is guaranteed. It is there in the PDR, the physician desk reference. So if you're wondering, how does this, can I take this? Talk to your doctor and tell them to look it up. Unicity Balance and Unicity Unimate, they're there in the PDR. What do I mean by guaranteed? If you use this protocol and use it as advised consistently for 90 days and you do not get the desired results, you can ask for a refund. Now, this company so believes in this product that they've been offering this since inception, and they're still here and growing bigger. So that means ain't nobody asking for refunds because everybody is getting results. And as you've seen, you know, what Dr. Tiffany showed you is just a speck of what people are experiencing. When you take these products, you stay in the fat burning zone and relief from symptoms instead of staying up there where you're storing fat, but also damaging a lot of your body proteins. It is available, as I said, in over 65 countries. Quality, if you're worried about, you know, is it just the company saying this? As you've seen, there's third-party certification, clinical studies that have been done. These products are, the ingredients are sourced directly from the farmers, so it's not some dodgy place where they're getting the ingredients. These are clean products, as clean as they come. Now, I have used these products myself since January last year, and that is what you see on the outside. But as Sheradon said, what you see on the outside is just a fraction of what is happening on the inside, because what you see on the outside depends on what has happened on the inside. The body has healed and now is glowing on the outside. I reversed insulin resistance. And as Dr. Tiffany said, you don't get diabetes overnight. I was diabetes waiting to happen. Never had an abnormal A1C. My A1C had never been above 5.2, but my fasting insulin was 57.5. While the ideal is 5 and below. That tells you it was just a matter of time before there was diabetes, there was fatty liver, before there was many other things, you know. But already I knew I had all those, you know, what did you call it? The wheel, the whisper wheel. Yeah, I already had the whisper wheel, the fatigue, no energy. I was losing hair. I didn't even realize. You know, you don't think about these things. That actually happened, that I noticed in retrospect that I had been losing hair. Perimenopausal symptoms, which I just said, well, it's the age, and I guess this is the way it's going to be. And that adds to the misery because I'm thinking, how many more years do I have to go through this? You know, and all these things changed. Everything has improved. Everything has, some happened right away. Over time, I have now lost over 9 inches of my waistline, 30 pounds, have so much energy. And I have talked about my hair growth and the change in my skin. This picture here, taken on January 28, 2025, the day before I started the protocol. A few months later, that's me. Leaner face, clearer skin. This is my hair. This, I realized when Google reminded me of these pictures from last year, March, and I looked at my hairline and I was like, what is going on there? Where is the hair? And of course I did a quick selfie on my forehead, you know, on my hairline, and my hair is now there. And I realized this is why people later last year had been asking me what's happening to your hair. What they were seeing were all these new locks that my loctician was starting, and they were thinking my hair was cutting. But I knew, because if your hair cuts, you see it. You see it on the bathroom floor. When you know, untangle your hair, you see it. I knew my hair was not cutting, but I kept wondering, what are they talking about? But now I later realized this is what they were noticing. The new locks, and they thought that was hair cutting. No, that was new growth. And so as Sheradon said, hair actually grows back. You know, we don't have to age and lose hair. So these are the things that happen. And, you know, I would like to call upon all of you. Don't wait. Don't wait for there to be a problem. One of the things that I always deal with, you know, as a family physician, we're the people who do a lot of urgent care. Patients are calling you and telling you, I have these symptoms and it all sounds like the flu. And you're telling them, no, you don't need an antibiotic. And I tell you, no, I need an antibiotic because I need to nip this in the bud. I don't want it to get worse. My prayer is that we take that same attitude that we have towards the flu and put it towards metabolic disease. Because when you have that whisper wheel, those are the things you need to nip in the bud before they become diabetes, before they become heart disease, before they become kidney disease, before you have full-blown anxiety and depression. Nip this in the bud, and you do have the tools to do that. Okay.
Yes, yes, yes. That's great, Dr. Esther. You said, okay, like I'm done. But you do have the tools. And so we do have a few minutes. And if there is anyone that has any questions, now is the time. You know, we're not charging you guys to hear from two doctors who spent the majority of our lives helping people. We're here because we love what we do. And so if you have any questions, now is the time. It looks like Dennis put in here, so there's hope for us men with the hair growth. I'm
Well,
still praying. Still praying. But you know what? That's a real good question. I want to say that we do have somebody who has noticed some hair growing back, but you know, I was just kind of being silly on that. So again, not only that, if you're in the you know, on the call, also put in the chat if you've been having any positive results and you know something great that you've noticed would feel great. If you have it, you know, you don't have to make up anything, but put in here some of the results you've had so we can go over that too. Oh, okay, that's a great question, Richard. And Dr. SGC Richard's question asking if this helps type 1 diabetes.
yes, I see that. So Richard, actually, Dr. Tiffany did show Vicky. Vicky is a type 1 diabetic. Now, type 1 diabetics, the reason it's type 1 is because they do not make their own insulin. So they need insulin from outside to keep them alive. You know, if they don't have that, because insulin is a hormone that we all really need. So they need that. But what happens over the years? The same thing, you know, lifestyle gets in the way, the kinds of foods we're eating, you know, what we are doing, how we are sleeping, and all these things. They too develop insulin resistance. And you can tell that because over the years, they end up needing more and more insulin. Yes, you'd expect from, you know, if you're a child and now you become an adult, then you need more insulin. But why does it keep going up even when you're an adult? You know, it's almost like every year or every 2 years, they're increasing that dosage. And you find at some point people are doing like 100 units of insulin, if not more. Now, when you start taking this protocol, that insulin resistance that has come from all that, the same things that cause insulin resistance in people without type 1 diabetes, you get rid of that. And therefore, your insulin dosage comes down. You always still need insulin because you don't produce insulin, but you now no longer have insulin resistance. Because when you have insulin resistance, even that exogenous, even that insulin that you're getting through a shot, there's also resistance to it. So now when you take away that insulin resistance, so you don't need too much insulin in your shot. So the dosage comes down. And that's why you saw Vicky reduce how much insulin she needed by up to 80%. So yes, it can help type 1 diabetics. It will not cure type 1 diabetes. They'll always need insulin. You just don't need to have that much. And therefore, they'll also not get all the complications because they also get all the complications of diabetes. They're also at risk for amputations. They're at risk for everything that type 2 diabetics are at risk for. So you reduce that risk too.
Mm-hmm. Mm-hmm. Yep, that was great. You broke that down very well. I figured you would. That's why I handed it to you. All righty. That looks like that's the only question we have in the comments. Well, Sheridan, because I like to have a picture where I have everybody that was on the Zoom, I got to pin you down here for a second, just for a second. So, one, thank you, Sheridan, for joining. If anybody has any comments or questions for Sheridan, now is your time too. But if not, Sheridan, what's something that you would say would be something that you would say to people who are interested in the system and the protocol and they're hesitant? What would you say?
Oh man, I mean, go into it to prove it wrong. Like go into it like I did. Prove it wrong, be consistent with it, give it 90 days and see what happens. The worst case scenario, you can get your money back. There's a 90-day money back guarantee, so you can just try it out. Prove it wrong, and I'm confident you will be proved wrong. I'm so grateful that I was wrong in this and that my husband was right, that it actually did help. And so try it out, try to prove it wrong. You know, I've heard a lot of people say, I'm not going to, you know, I'm just going to do this, see if it works, and it does, but be consistent with it, do it the way that it's supposed to, and it'll work.
Mm-hmm. Mm-hmm. Yep, I agree. I see some heads nodding too. They agree too. So good. I'm glad to hear it. My father was somebody who ended up passing after his third stroke, and he was looking for something natural. And so it took 3 strokes to take him out of here. And I know I'm not the only one that's lost loved ones or family members. So then the question becomes, once you are shown this information, once you are shown the stories, once you are shown the science, what stops you from sharing with your family members or even using it for yourself? What is stopping you? Are you waiting for the next Monday to happen? Because we all start over on Mondays. Monday's the day to start over, right? Are you waiting for the next New Year's resolution? Are you waiting for the next event so you can be cute in your dress? I mean, all those things don't matter when we're talking about quality of life. We're talking about being here for your family. We're talking about being able to get up from the table and your kids not wondering why your belly's not rumbling or why you're holding it. We're talking about not having to be on antidepressants or blood pressure medicine or staying in the hospital and having all those bills. We're talking about quality of life being improved. So if this is anything that resonates with anyone, please get back to the person who invited you on this call. They have a link that can allow you to get, $100 off. Who wouldn't want that? Yeah, you can go directly to Amazon, where the company's on Amazon, or even to the company's site. But who wouldn't want that $100 off? I know I would. Let me tell you that. And you keep that discount regardless how long. If you decide, oh, I'm gonna try it for a week, when you come back, you'll still get that discount. And it connects you to people like us, people who care, people who want to see you reach your health goals. And so, Dr. Esther, before I shut it down, you have any parting words?
No, I think I said everything I'd like to say, and just echoing what you all have said. Try it to prove us wrong. You know.
Yep. It's that simple. Better yet, for the person who says, I've tried everything, the Weight Watchers, LA Weight Loss, I've tried Mediterranean diet, my cholesterol didn't get her, my blood pressure didn't get any better. Let this be the last thing you try. How about that?
Yeah.
And bring somebody with you next time. Thank you so much. So happy you all came on tonight. Thank you, Sheridan. As always, you're the best, Dr. Esther. You guys have a wonderful night.
Good night, everybody. See you
Good
next
night.
Wednesday.
Thanks a lot, everyone.
Yeah.